Every year, tens of thousands of people in the U.S. die from an opioid overdose. Here in Texas, according to the CDC, more than 2,500 people died because of a drug overdose in 2015. And the question a lot of people in the drug industry are asking is, why is the number so high when this can be prevented? Joining us now is Tom Duddy with Adapt Pharma. He's here to talk to us about how Texas specifically is trying to combat this public health emergency. Thanks a lot for joining us, Tom.
Hi, Alicia.
So let's start talking about Narcan, because Narcan is actually a drug that reverses an overdose.
Absolutely.
Let's talk about how exactly it works.
So very simply is when you're going into an opioid overdose, there's a opioid attaches to a receptor on your brain and you stop breathing the more opioid. So that's as simple as your respiratory goes very shallow and you stop breathing. What Narcan or Naloxone does is takes the opioid off the receptor and allows for breathing to be restored.
How quickly does this actually work?
It depends upon the opioid in the body. So if it's a synthetic opioid versus an organic opioid, it just depends on the quantity the patient has.
So I know Narcan is being used across the country, specifically in emergency situations. First responders are using it, but I wasn't aware of the fact that it's available as a prescription.
Not only as a prescription in Texas, you can walk into any pharmacy without an individualized doctor's prescription, walk up to the pharmacy counter and ask the pharmacist, may I have Narcan? Put your insurance card down. It's the mass distribution of Naloxone that the state is actually looking for, and most states are, but Texas is doing a great job of making sure that Naloxone is where the overdoses are occurring. Where most of the overdoses are not occurring near a medical facility. They're happening in our community.
So Naloxone, just to clarify, is the name of the drug and Narcan is the brand.
Correct.
Right? Okay.
Correct.
So I'm wondering, how often are people actually, doctors, prescribing Narcan?
Well, right now on average weekly numbers are around 157 to 235 prescriptions of Naloxone a week.
Each week?
Each week.
Okay.
Now, but the scary thing is there's around 277,000 opioid prescriptions a week.
Wow.
So we tend to focus a lot on the illicit, the heroin, fentanyl overdoses, but there's data to support about 40% of the overdoses happen with prescription drugs, prescription opioids that were prescribed legitimately by a physician. All
right, so at least it's good to know that this is available here in Texas and there are efforts being made to get this into the hands of more people.
Absolutely.
All right, Tom, thank you so much for joining us this afternoon.
Thank you.
Really appreciate it.